The Carers Association joined the ERA network to build a more equal society for all. Carers are supporting family members who require high levels of support due to illness or due to severe disability or frailty in old age. And the age range is right from children right through till old age. The carers are providing over 3.7 million hours of care every week of the year. Full-time carers are placed in a very vulnerable position due to working exceedingly long hours, inadequate or no supports, high levels of stress and no time for their own social life and their own particular needs. Carers' work is not counted as part of our economy, even though carers contribute over 2.5 billion euros of work to our economy every year. We need a national carer strategy and an implementation plan, which was promised by the government in the social partnership agreement, which hasn't been implemented. The Carers Association, the Carers Allowance was cut back during the last budget. And that, I'd like to give you an example of the effects of that. A woman here in Dublin who is on disability herself and is wheelchair bound, is looking after her elderly mother who is also wheelchair bound. And she performs dialysis on her mother with support from the HSE. And it saves the economy 50,000 euros a year because of this service that she's providing at home. Now, her half-rate carers allowance was cut back during the budget, and we found that the Minister could not give us any guarantees that the half-rate allowance itself, the full amount of the half-rate allowance, would not be cut back during the budget and done away with altogether. So by most measures, her mother would need to be in a nursing home where it would cost the government 1,200 euros a week. So for the sum of 102 euros a week, this carer is maintaining her mother where she wants to be in her own home and saving the state a huge level of monies. Now, I'd like to touch on acute hospital services. They're moving more and more services for people out of the acute hospitals into the home and into the community. And this is an actual transfer of workload from the hospital and the professionals out onto carers within the home. And that has been done without building up the support for carers at the domestic and community level. And it's quite exploitive of carers. And we would like to see that this is addressed by a partnership with the institutional and hospital services so as that there is not a further exploitation of family carers. The HSE themselves are now viewing the carers allowance as a payment for services provided by carers, which it is not in law or from the point of view of the Department of Social Welfare. And this is happening at a time when the workload of family carers is increasing in hours and in the complexity of the services they provide. So we would like to see this decision reversed immediately. Again, I would like to touch on the issue of young carers. There are tens of thousands of young carers in Ireland. And to give you one example, one 13-year-old girl has been caring for her mother since she was 9. Her mother is unable to look after herself due to a severe back injury, and she is very dependent. This young carer is the only child within her family, and she has to grow up very fast and missed out on many childhood experiences. She does the shopping, she does the cooking. She gets up at 7 o'clock in the morning in order to give her mother her breakfast, to wash her, to dress her, and then she goes off to school. And when she comes home, her caring continues. So many young carers miss school frequently and fall behind in their homework and lose out on the normal social life that's essential to growing up. And they do not receive the supports they need in order to lead a balanced and healthy young adolescent life. And finally, I'd like to talk about Anne, who has been her husband's carer since he was diagnosed with Parkinson's disease some years ago. Subsequently, he has developed cancer and has to have treatment of surgery and chemotherapy. He has, because of this, his mobility, his speech and his general motor skills have been severely impaired, and he depends on Anne for every aspect of his daily life, from dressing, washing, feeding, toileting, and all other aspects of his life. So Anne's caring role is really a day and a night role. And she does not receive any respite services or any support services into the home. Most of their additional expenses that they must try and find are not covered by a medical card. For example, Tom has special dietary needs and has to have heating going within the home all the time. To go to his medical appointments, he has to go by taxi because there is no public service. So in terms of equality and justice, family carers must have their needs recognised in law as workers providing core health and social services in partnership with those who are receiving the care and with the statutory and other providers. And that is what we would like to see as part of the election manifesto for carers. Thank you.